Sonnies, today we're so happy to welcome back Sonny and Wendy from Epicure, an organization that continues to turn compassion into action across Northeast Florida. Epicure has now rescued and distributed more than 46 million pounds of food. We had to go through that this morning, right?
Yeah, I was trying to figure out, since I'm a visual person, I'm
Yeah.
like, what does that exactly look like? And it breaks down to like 36,000 pallets.
Can
of
you
food.
imagine?
That's a lot.
That is a lot. They are reducing food waste. They're feeding families. They're supporting nonprofit partners and helping communities during crisis and building a broader vision around health, dignity, and access. Since the last time they were here, Epicure has continued growing in major ways, from warehouse expansions to plans to food and medicine, medical equipment distribution, and deeper partnerships across the region. Sonny and Wendy, welcome back to Sonny TV.
Well, thank you so much for having us.
Yeah. So let's do a quick update with Epicure since the last time we spoke. How's it going?
It's actually going really, really well. So, we continue to build partnerships, grow our infrastructure, build transportation networks. And so through all of those partnerships, we're able to rescue more food and help more families and community partners in need.
I think it's awesome. I mean, I love the whole semi-truck program too. I think that's fascinating. Can you talk a little bit about that? And is it still going successful?
Yes. So there's one of the things that we've discovered along the way is that there is a lot of waste in the trucking industry where they'll go to deliver food and it will get rejected for a variety of reasons. It can be just showing up at a dock time too late. It can be having too much product on the truck or the wrong product on the truck, or their temperatures were off slightly. So, if you didn't maintain 40 degrees the whole way through and it got to 41 degrees, they'll reject an entire 40,000 pound load because of 1 degree. It doesn't mean that the product's not safe anymore. It just means that the company won't accept it. So we take in those rejected loads, and then we just are able to provide that food for free to families in need.
That's awesome. So Wendy, food is safe when it's rejected like that?
Absolutely. I mean, obviously, we go through a sorting process when the food arrives, and we do have a criteria of what is fit for human consumption and what is not. But thankfully, even the food that we receive that is not acceptable for human consumption, like we recently had a lot of bananas, and they get ripe really quick, especially in Florida in the heat. But we're able to distribute those to farms.
Awesome.
And so we are a zero waste organization, so nothing goes in the garbage. We rescue the food, we unpackage it, we get it ready for the farms, and they're able to come and pick that up and put that back into their business. So.
I love that it's full circle like that, right? I think that's obviously been the vision from the start, is making sure everything goes to as a fruition for something.
And I
right?
will say, like going to the grocery store, right? Like I went to the grocery store and I got like stuff to make dinner. And let me tell you something. I spent $100 and it was like one bag of nothing.
Right.
Yeah.
So, and then I think of people who live on a fixed income or can't get out of their house, or that single mom who has 4 children and she's like working her butt off. And then it makes you realize, like, you're standing there, and I was like, oh my God, Epicure, like it breaks down in your mind in real time what you guys do.
You know what that just reminded me of?
What?
That Reba McEntire song.
I'm a survivor. Yes.
I love it.
But I don't think people like realize enough of what you guys do and how easy it is to access you, reach out, and get the help they need.
Yeah.
And
This
the
is
impact
huge.
is incredible because, if for every donation that you make, for every $1 that you give us, we are able to, because we are rescuing the food, we're able to turn that into $73 worth of groceries.
It's amazing.
Because of the infrastructure that Sonny has set up, and because we're a 100% volunteer organization, and because we put everything into the logistics of making that happen, we're able to, for $1, we can turn around and give that single mother $73 worth of groceries.
That's amazing.
Yeah.
Sonny, 46 million pounds
Holy moly.
of food. Do you have like a thermometer in the warehouse of like showing like, okay guys, we're almost here, here's another million? Like, how do you guys calculate all this?
Well, we actually weigh every single thing that comes into the warehouse,
Okay.
And our backs feel it.
Yeah, definitely, right?
Yeah, but everybody that works with us, all of our volunteers, they take ownership of what what they do because they see the direct impact of the work that we do. So we're able to maintain this whole organization as a 100% volunteer organization because of that. So they'll they'll run the warehouses, they'll lead distributions, they service our equipment, they recruit more volunteers when we need them. I mean, the mission becomes the volunteers because they care so much about what we do that they help us continue to do more. And like if you look at just 2025, we were rescuing between 800,000 and 900,000, maybe 1 million pounds a month sometime, but the last couple of months we're up in the 1.3, 1.2, 1.3 million, and we're on track to do that again this month. And that's just because of our amazing volunteers and our partnerships. And as Wendy said, our farms, because as we continue to grow, we need more farms to take the food that can't be good for people. So it's been an incredible journey.
How do you? I mean, we do talk to a lot of farmers out there too. Like, how do you reach out to farms? Is that just word of mouth, or is it something that you actually go out into Hastings and introduce yourself? How do farms get connected with you?
So it's mostly, people that have pigs and chickens and goats and cows and all that kind of stuff. But we have a regular, so there are farms that pick up from us every day, 7 days a week, both warehouses. And then when we get these massive surpluses, like the bananas that we got where we only had 2 days to distribute them before they were beyond good. And then we put basically out on social media. And so
Gotcha.
The farms will follow us on social media. And so instead of sending out, calling and spending our time doing that, that's our best way to distribute
I got to tell
the
you, we talk to
information.
farms every single month.
Yep.
So I'm going to start connecting too and making sure that they have that resource because farmers are going through it. I mean, we hear the developers and keeping the farmland and keeping the legacy alive. So I think that's just so important is to keep, any kind of resource.
And going back to what you said, Sunny, about your volunteers, like they take the ownership, they really value it.
Yeah.
I say all the time, it starts at the top. So the example you're setting and just the passion that you ladies have for it, I think that radiates to everybody. And you can't have people that are involved in your organization, people don't just automatically love something. So, the fact that you get down in the, lack of a better word, trenches with them, that's like a true testament to, but you're in your mind, you're like, I'm just doing my job. Like, but it really speaks volumes to what you've created. This is amazing, ladies.
Yeah, well, and a lot of our volunteers are also recipients. So sometimes we'll recruit volunteers because they'll be standing in line and see how busy we are and see the work that needs to be done. And they'll hop out of line and put some gloves on
I love
and
that.
start volunteering. And then, wait till the distribution's over and before they can collect their food. But they see the value in it. They see how much food is being rescued and how many people are being helped. And so, many of our volunteers are also recipients.
Wow. The Palaca warehouse, how's that going?
The Palaca warehouse is amazing. So we just raised the money 2 months ago to do some spray foam insulation.
Awesome.
Because it was a metal building, and I'm telling you what, that
I know.
the
Yeah,
misery
trust me.
factor in the summer was.
Mel
it
goes
was-
through it every day. She's a cheer coach. Yeah.
I mean, we're basically a metal warehouse that's insulated and we have AC units, but let me tell you,
And
I know
yeah.
what a roasting chicken feels
Yeah,
like.
major,
every day.
Yeah,
major.
well, we don't have air conditioning, so we're thankful
Oh,
for
oh
the
my gosh,
insulation.
okay.
Yeah.
Oh, yeah.
So you know what popcorn feels like then.
I'm
Yeah.
dying for you right now.
No, it's okay. You get used to it. Then you just don't like air conditioning. That's why I said I like your bathroom because it's heated. I was like, I'll go hang out in there.
Perfect. Yeah, but no, so let's talk about the rally of the expansion. I mean, you said some insulation. What else is going on with that?
Well, so the Palaca warehouse is basically done, but we're still, we have a capital campaign going or a campaign going to raise the additional funds that we need to build our St. Augustine warehouse because we're renting a 2,000 square foot warehouse in St. Augustine. We have a 14,000 square foot warehouse in Palaca, but we're building a 10,000 square foot warehouse here in St. Augustine to help us expand and rescue more food. And so we received a $1.5 million appropriation from the state of Florida a year and a half ago, and we're in the state budget right now to get another $600,000. So as long as we don't get line item vetoed, anybody knows Ron DeSantis, tell him not to do that.
We're crossing
then
our
we'll have
fingers.
that, and then but we still have a gap of over $1 million in what we need to raise to finish the building. But that building is going to be absolutely amazing because it's going to be dock height, and so we'll have 3
Great.
loading bays, so we'll really be able to move
Bring
the
it in.
semis in and out quickly because you really want to be able to work at that level if you want to scale up food distribution, you have to increase the efficiency of your
The trucks,
warehouse
yeah.
and all logistics operations. But in that warehouse also, we're building our 3,000 square feet of commercial production kitchens, which Wendy can tell you about our goals on that one as well.
Yeah. What's that looking like?
Yeah, what is that?
Yeah, so food as medicine is always kind of in our hearts, right? So we know that it makes a big impact over the, the general, wellness of anyone. We know one of the number one, determinant of health is access to healthy food.
True.
And so, we have a lot of patients that are, being discharged from the hospital, that go home, and we give them a whole list of things that they can't eat, but they don't know what they can eat. And even just trying to get to the grocery store is a challenge. And the waiting list right now for Meals on Wheels is
It's
through the roof.
Oh,
ridiculous.
yeah. That's a sad
And so,
story.
yeah,
Absolutely.
Yeah, so we're hoping to be able to bridge that gap with our kitchen and being able
Fantastic.
to create tailored meals specific to whatever the disease process is that the patients have, and being able to figure out a way to get these meals to their homes to try
Oh,
to
my
meet that
God.
need. So that's our goal, and so we're looking forward to having that opportunity with this newer house.
So how can the community rally around that? Because we do hear that often, that Meals on Wheels is literally struggling right now, especially with I think there was some funding even cut from that program. So how as a community, how can we rally? That's what St. Johns County does. We get our bootstraps and we go for it. So how can we help with this?
I think I'm donating to our capital campaign so we can get our kitchen up and going. The faster that we get those funds raised, the faster we can get this warehouse done and built, and the faster we can get that first meal out the door.
Absolutely.
When
Yeah.
you guys have you meet these goals, 46 million pounds of food, do you guys stand there and does everybody yeah? Do you have a cheer or pep rally in the warehouse?
I do. I feel that
I
because
feel
you
like
have
it would
amazing
be.
volunteers.
You'd
Yeah.
be yeah, we did it.
They have
What does that
such-
look like in there?
They're not
Such
like
an
that.
energy.
They're like, okay, we got to do more.
Yeah.
There's
I
more
love
out there.
that.
Let's go.
Yeah.
I know one of our volunteers out in Palaca, he goes, we're going to go global. So, get to it.
They're dedicated to the cause. Army is one of our retired nurses in Putnam County, and she's all over it. She has this app that she watches the trucking companies that have these rejected pallets.
Oh, my goodness.
It'll be 11 o'clock at night, and we'll show up in the morning, and we'll have a semi-load of popcorn in the warehouse.
Oh
And
my
she'll be like, I
gosh.
saw they rejected a warehouse. I got up at 11 o'clock last night. I went and drove across town to go meet this trucking company to pick up all this popcorn. So we have popcorn now.
Yay!
Oh my gosh, I love that. God, it gets me a little choked up in my
That is
feels.
amazing.
For volunteers to go above and
Yes.
beyond
Yeah.
for the greater cause,
But
that's
that
just
goes back
amazing.
to
Yeah.
what you ladies built, that
Yep.
they love it so much.
Right.
You built this train and it is just speeding down the tracks and there's no stopping in sight.
So you work with a lot of other counties out there too, and how do you measure the metric of need? You know what I mean? Does Putnam County need more bread than St. Johns County?
That's a good
or
question.
How do you work that through?
So we don't really look at that. So our goal is to make the best variety of products available across all of our distributions.
Okay.
So, when we're looking at inventory, we look at the inventory of both warehouses. We always have kind of a three-week projection out in the distributions that we have coming up so that we can, kind of strategically reserve food to make the best, like I said, possible variety available. And then anything beyond what we need over the 3 weeks is what we have surplus that we share with other agencies. So again, trying to get them to have their best variety of things available. And so, meat is always the top ask in any distribution, and typically we always have at least 3 packs of meat per family per week. Sometimes we have more. We're working on partnerships to increase that the protein that we're getting in, because through food rescue that's kind of limited, and it's about 14% of what we rescue. So we're working with some other organizations to see if we can get that up, where we can have at least 5 or 6 packs of meat per family per week. But we always have dairy. We have a lot of produce. 40% of what we rescue is fresh produce, which is one of the most expensive items in the store
Yeah,
next
and it
to
doesn't last
next to
long.
protein. Yeah, and so we work really hard, and we actually do an amazing job, I think. Thankfully in the last few weeks we've had a ton of milk, and I don't know whether it's just because school just got out or what. I've never seen the amount of milk that we've had
Interesting.
recently. Yeah, and
So it kind of ebbs and flows. You
Yeah.
really just don't know, but you're like, okay, we can figure out where. And so how do families get access to some of this food?
So if you go on our website, we have a link to, it says food resources, and that shows all of the distributions that we do, as well as everybody else that operates in both St. Johns and Putnam counties. So they can find the date, time, and location that works best for them, and we keep that up to date all the time.
And they just show up? Do they need to sign up or anything? Or is there...
For our distributions, they're open to the public. It's first come, first served. There's no income
That's amazing.
verification, no ID required. There's no questions asked. If you're there, you get food.
That's amazing.
I'll tell you what, because a lot of times with
Yeah, you
things
know where I
like
was
this,
going with that, yeah.
yeah, you have to show your ID, and you have
Right.
to, and, you know, there's a
That's
lot,
of fear there.
yeah, and a lot of people have situations in their current life that they don't want to be found.
Mm-hmm.
So, you
Well,
know,
and also, I don't know if you've ever been poor, but it's hard. Life is difficult, you know, and you
It's
have
hard
to
to
qualify
ask
for
for help.
everything. Yeah, and
Yeah,
you have
the
to. There's so
paperwork
much
and
paperwork
Yeah,
involved.
and then
in
you
all
get
Bring
that.
your
told-
bank statements and your
Yeah.
pay stubs.
yeah, and then you get
tax
told
returns
no,
and-
no,
And
no.
so we want to be that
The
easy,
yes.
but you know, we want to be the easy button.
Button.
Just come to us.
Yeah.
We'll take care of it. You know.
Yeah.
So, Wendy, last time we talked to you, we were talking a lot about like some global initiatives too, which is pretty amazing. I mean, Epicure really does focus on the regional, obviously, with food and insecurities and things. But can you talk a little bit about the global initiative that you guys are working on?
Absolutely. So part of our initiative, we have a little side gig going on called Epic Med, where we're rescuing medical supplies. My husband and I are both medical missionaries, and we travel a lot, and so we see the need, you know, internationally. We work in places like Haiti and like Ukraine. We've been there 8 times since the war began.
Oh my gosh.
God bless.
You know, we have other friends that are working in the space of Gaza and, you know,
Oh.
other places. And
One of my greatest friends is going out to Ghana right now. I mean, with
Yeah.
the scare of Ebola, but she's like,
Yeah.
I'm going. I don't care.
Yeah, I mean, and you need those people that have that heart to be able to do that response, right? So, but we're able to respond, you know, in a really meaningful way by providing the medical supplies that we're rescuing, because people always know that we do this kind of thing and they always want to give it to us. And we've partnered with Wildflower Clinic.
Oh,
because people-
amazing.
People bring all of their stuff to them, and they're in such a small space, they don't have anywhere to store it, but they don't want to throw it away. So Sunny thankfully gave us the loft at the warehouse to be able to bring all that stuff and organize it on shelves. And our volunteer, Dave, who's a nurse, he brings in all that inventory, inspects it, makes sure it's safe, not expired,
Awesome.
makes sure it's safe, and then puts it on the warehouse and inventories it. And then that way, people that are locally experiencing need have access to that, but also medical
Oh.
missionaries and NGOs that need their supplies for their mission can come in and shop and get the items that they need. In Haiti, when we had to evacuate our kids from a very unsafe area where we had to evacuate them from gang territory and relocate them, we showed up in a new town in Haiti with nothing. And Epicure helped us stock an entire container full of food and supplies for the kids, and sent that over to them so that they had a fresh start in a new home.
How's the inventory looking?
It's looking really good right now. I mean, hopefully we'll send another container in August, but you know, food in Haiti right now is extraordinarily expensive.
Yeah, true.
And so it just kind of helps us, you know, keep the budget, you know, reasonable and keep the kids fed and safe where they're at. So.
Oh my, you guys, I
Yeah.
can't. This
What
is-
kind of medical supply? I mean, we're talking walkers, wheelchairs, crutches, things like that, braces, or
Absolutely. Actually, we have a really big need for walkers right now.
Good.
Because we have a lot of patients that are being discharged from the hospital that, obviously walkers cost money. And if they're uninsured or underinsured, just to try to go buy a walker on top of the medical expenses, on top of they haven't been able to work, it's like one more thing, you know, but they need that when they get home after surgery or while they're, you know, recovering. And so, you know, to be able to go to the hospital and deliver a walker to that patient so they can get out of there and get home and get on the recovery process.
I love that.
Yeah.
I love that.
Yeah, well, her husband actually was trying to discharge a patient, but they couldn't discharge him until they had a walker.
Oh,
So he
really?
ran over to the warehouse, grabbed one, brought it back to the hospital, discharged the patient.
God
So,
bless.
Yeah.
Oh, God.
And so,
Yeah.
but the program, we haven't even advertised that program, and it has exploded.
It has.
I
yeah.
mean,
it's all
like-
been word of mouth so
Yeah,
far.
and then
yeah.
we're working with national organizations, and we got in, what was it, 10 pallets of prescription eyeglasses
God
that went
bless.
to Haiti and Ukraine.
Yep.
And we have currently 20 pallets of shoes that are destined, I think, for Africa and
Oh my God.
and somewhere else. And then
They'll go to Haiti as well.
Haiti, and then we're working right now on the getting shipped. We got an offer, and they're free, but we just have to pay for shipping for 52 electric exam chairs.
Oh wow.
Those are not light.
Yeah,
Yeah.
and so, but those will come, and Wendy's already working on getting those placed in Mexico.
How on earth do you deal with the shipping? I gotta ask that.
Well, thankfully, there's other people that work in logistics space that also work with medical, you know, or with missionaries that need supplies to
Awesome,
get pushed
okay.
out.
Okay.
And so it's still not cheap.
Yeah.
And there's a lot of fundraising going behind getting these products moved to the areas they need to go to.
Yeah.
I mean, for me to send one small container to Haiti is gonna probably cost around $3,000.
See,
Jeez.
yeah,
Yeah,
exactly.
so-
And then, so with like, I'm a visual.
Yeah, here we go.
But with the chairs and stuff, those have to go in like a shipping container, don't
Yes,
they?
Yeah.
Yep,
Yeah.
they
So
will.
then, I'm just picturing like, oh my God, like,
Yeah.
do you
Cha-ching.
guys own a helicopter or something? Like, what
Yeah.
are you gonna
No.
do next?
Well, I mean, we work with a lot of logistics companies, as she said. We can't get the stuff transported to us for free. So we do have a cost to get it to us. And so usually we'll just put that out in an email asking for a donor, and then whoever, we've gotten everything covered that we've asked for so far. But people see the value in that. It's like, this is $250,000 worth of equipment that we're getting for free, and all we have to do is get it from Georgia to us.
Yeah.
So it's going to cost a few $1,000s, but given the value that is to, to countries that really couldn't afford this otherwise. it's
Absolutely.
huge.
You
It's such
ladies
a
are
need.
like magical unicorn people.
Absolutely magical unicorns.
I don't know another way to explain it, but just like, and the way you guys are just talking about, like, well, this is where it's like, it's not stopping. It's like, this is what we got.
I don't have. You
love
don't
this.
hear fear. You said that
No.
you see freedom of yes, we are going to make this
It's
happen.
just a yes,
which is
like-
amazing. And there's a lot of people listening right now. What is the biggest need, and how can people rally right now with Epicure?
So we have several needs. We definitely could use a fund for covering transportation.
Awesome.
Because these things pop up very spur of the moment, and you have to be able to react instantly. And so just a fund for that would be amazing. We do have a need. People ask about volunteering all the time, and on Monday, Tuesday, and Wednesday in Palatka, we do have a need for at least 4 or 5 more volunteers. If you come out there, you're going to be working with me. I'll be there. So
Yay.
come on. Talk to me all day long.
Awesome.
And then the capital campaign, obviously, if anybody really, and we do have naming opportunities in that. So if we have different levels of donating that will allow you to have a naming opportunity.
Fantastic.
If you want to donate like $1 million, you can put your name on the building.
Hey, it's easy
saying.
peasy. That's wonderful. I know a lot of people that love to
No
do that.
problem.
And
Absolutely.
Then, and then we do have our one fundraiser a year. We're kind of sad and sorry on that part. But our
But
one
it's a
fundraiser,
fun
it's a fun one. So
fundraiser.
Wendy runs this one for us, so she can tell you about it.
Yep, so we have a charity 5K coming up on October 17th. It's the Shine a Light 5K for Epicure. We still need sponsors for that race, so if
Awesome.
you want your logo on our amazing t-shirts and swag and website, just give us a call. We'll get you hooked up. And if not, sign up, show up, have a good time. Yeah.
Speaking of t-shirts,
Yeah,
this
we
shirt,
got.
when
Look at
they-
this.
Look what they gave us.
It says food waste is
It's
bananas.
bananas.
Yeah.
I love
You guys are amazing. Thank you so much for your time today.
Thank you.
Thank you for
Let's
having us.
all rally around Epicure, doing not only regional and local initiatives, but there's
the
a
world.
global touch too. This is amazing, amazing servant's heart. Guys, we're going to take a quick break with Maritime Creative and Flashes and Brilliance.